Deep within our bodies, two bean-shaped organs work tirelessly, filtering waste products from our blood. These are our kidneys, essential for maintaining a healthy balance within our system. End-stage kidney disease, also known as kidney failure, is a serious condition where the kidneys can no longer perform this vital function. The kidneys struggle to remove waste and excess fluid, leading to a buildup of toxins in the body. End-stage kidney disease is a global health concern, affecting millions of people worldwide. Understanding this disease, its causes and treatment options is crucial for early detection and effective management. By fostering awareness and understanding, we can empower individuals to take charge of their kidney health and seek timely medical intervention. End-stage kidney disease often progresses silently, with early symptoms being subtle and easily mistaken for other conditions. This makes it crucial to be vigilant and aware of the warning signs. One of the earliest and most common symptoms is a change in urination patterns. Individuals may experience increased frequency, particularly at night, or a decrease in urine output. This can be accompanied by changes in the color or appearance of urine. Fatigue is another hallmark symptom, often described as an overwhelming tiredness that persists despite adequate rest. As the disease progresses, individuals may also experience swelling, particularly in the ankles, feet and legs. Other noticeable symptoms include loss of appetite, nausea and vomiting. Persistent itching, dry skin and muscle cramps further highlight the body's struggle to maintain a healthy balance. These symptoms can significantly impact daily life and overall well-being. If you experience any of these symptoms persistently, it is essential to consult a healthcare professional for a proper diagnosis. Early detection and treatment can make a significant difference in managing the condition effectively. End-stage kidney disease is rarely a spontaneous occurrence. It is often the culmination of underlying conditions that progressively damage the kidneys over time. These conditions can silently progress, often without noticeable symptoms, until significant damage has occurred. One of the leading causes is diabetes, a chronic metabolic disorder that affects how the body regulates blood sugar levels. Uncontrolled diabetes can lead to high blood sugar, which over time damages the blood vessels in the kidneys. Another major culprit is high blood pressure, also known as hypertension. Persistent high blood pressure can cause the arteries around the kidneys to narrow, weaken, or harden, which impairs their ability to function properly. Other conditions that can contribute to end-stage kidney disease include glomerulonephritis, an inflammation of the kidney's filtering units, polycystic kidney disease, a genetic disorder causing numerous cysts in the kidneys, and chronic urinary tract infections, which can cause repeated kidney damage. Certain risk factors can increase an individual's susceptibility to developing end-stage kidney disease. These risk factors often interact with underlying conditions, exacerbating the damage to the kidneys. These include a family history of kidney disease, advanced age, obesity, smoking, and prolonged use of certain medications. Lifestyle choices and genetic predispositions play a significant role in the progression of kidney disease. Understanding these causes and risk factors is crucial for early detection, prevention, and effective management of end-stage kidney disease. By recognizing the signs and taking proactive measures, individuals can significantly reduce their risk and improve their overall kidney health. Diagnosing end-stage kidney disease involves a comprehensive evaluation of kidney function and a thorough assessment of the underlying cause. This process is critical to ensure that the right treatment plan is developed. The process typically begins with a detailed medical history review and a physical examination. These initial steps help to identify any symptoms or risk factors that may be present. Blood tests play a crucial role in evaluating kidney function, with key indicators being creatinine, which measures how well the kidneys are filtering waste, and blood urea nitrogen, BUN, levels, which can indicate how well the kidneys are functioning. Urine tests are equally important in diagnosing end-stage kidney disease, with proteinuria being a significant red flag. The presence of protein in the urine can signal damage to the kidneys. Imaging studies such as ultrasound, MRI or CT scans may be ordered to provide detailed images of the kidneys. These images help in assessing the size, shape and structure of the kidneys. In some cases, a kidney biopsy may be necessary to examine a small tissue sample under a microscope. This procedure can provide valuable information about the extent of kidney damage. This helps confirm the diagnosis and determine the underlying cause of kidney disease. Understanding the root cause is essential for tailoring the treatment plan. Early and accurate diagnosis is essential for effective treatment and management. Timely intervention can slow the progression of the disease and improve the patient's quality of life. While there is no cure for end-stage kidney disease, several treatment options are available to manage symptoms and improve quality of life. The most common treatments are dialysis and kidney transplantation. Dialysis acts as an artificial kidney, filtering waste products and excess fluid from the blood. There are two main types of dialysis, hemodialysis and peritoneal dialysis. Kidney transplantation offers a more permanent solution, involving surgically replacing a diseased kidney with a healthy one from a donor. Transplantation can significantly improve quality of life and increase life expectancy. In addition to dialysis and transplantation, treatment focuses on managing symptoms and complications. This may include medications and dietary modifications to reduce the workload on the kidneys. End-stage kidney disease can lead to a cascade of complications affecting multiple organ systems. One of the most common complications is fluid overload, which can lead to high blood pressure and swelling. The kidneys play a crucial role in regulating electrolytes, and their dysfunction can lead to imbalances. High potassium levels, known as hyperkalemia, can be particularly dangerous, causing irregular heartbeat. Anemia, a deficiency of red blood cells, is another frequent complication. End-stage kidney disease also increases the risk of cardiovascular disease, including heart attack and stroke. Other potential complications include bone disease, nerve damage, itching, and an increased risk of infections. Managing these complications is crucial for improving quality of life and prolonging survival. While not all cases of end-stage kidney disease are preventable, there are several steps individuals can take to reduce their risk. Managing underlying conditions like diabetes and high blood pressure is crucial. Controlling blood sugar levels through diet, exercise, and medication is essential for preventing kidney damage. Similarly, managing high blood pressure through lifestyle modifications is vital. Maintaining a healthy weight and quitting smoking are also important preventive measures. Limiting alcohol consumption and avoiding over-the-counter pain relievers can protect kidney health. These steps can significantly reduce the risk of developing end-stage kidney disease. Diet plays a crucial role in managing end-stage kidney disease and slowing down its progression. The goal of a kidney-friendly diet is to reduce the workload on the kidneys by limiting certain nutrients. Limiting potassium intake is essential, as high levels can be dangerous for people with kidney disease. Another important dietary change is limiting phosphorus intake to prevent complications. Controlling protein intake is also important, as too much protein can stress the kidneys. Working with a registered dietitian can help determine the appropriate amount of protein. Other dietary recommendations include limiting sodium intake, choosing heart-healthy fats, and staying well hydrated. A kidney-friendly diet can significantly improve quality of life for individuals with end-stage kidney disease. Living with end-stage kidney disease can be challenging, requiring significant adjustments to daily life. Treatment regimens, such as dialysis, can be time-consuming and disruptive. It is essential for individuals with end-stage kidney disease to have a strong support system in place. Connecting with others who understand the challenges of living with kidney disease can provide emotional support and practical advice. Managing stress is crucial, as stress can worsen symptoms and complicate treatment. Engaging in stress-reducing activities can be beneficial. Prioritizing physical health, including following a kidney-friendly diet and regular physical activity, is essential. The field of kidney care is constantly evolving, with ongoing research and development of new treatments and technologies. One promising area of research is regenerative medicine, focusing on repairing or replacing damaged kidney tissue. Another area of innovation is artificial kidney technology, with smaller, more portable dialysis machines in development. Advances in genetic testing and personalized medicine are also expected to play a significant role. Early interventions can prevent or delay the onset of kidney disease. The future of kidney care holds great promise for improving the lives of millions of people. As research and technology continue to advance, we can look forward to more effective treatments and improved quality of life.